Good morning, everyone. I have 10 o'clock on my computer screen. I want to welcome you to today's SEAside webinar, Predatory Publishing, How Can Librarians Lead the Way? At the moment, you should see a couple of questions on the screen. Take a few moments to consider these two questions and share your thoughts in the chat box. When sharing your thoughts, please be sure to select all participants so that everyone can see what you type. Additionally, if your library has a resource page dedicated to publishing for your users, please feel free to share that in the chat box as well. I'm Tony Gwen, Technology and Communications Coordinator for the NNLM Southeastern Atlantic region. Before I introduce today's speaker, I have a few housekeeping items. As a reminder, if you need closed captioning for today's webinar, I've shared the link on this page. I'll also share the link for closed captioning in the chat box for everyone to click on as well. For today's presentation, please be sure to use the chat box to ask your questions. Also, be sure to send them to all participants, and I'll read your questions to the presenter to answer as they come in. Today, we have Carrie Price. She is a clinical informationist at the Welch Medical Library at Johns Hopkins University in Baltimore, Maryland. Her primary work involves providing reference and support to allergy and clinical immunology, geriatrics and gerontology, nursing, neurology, neurosurgery, orthopedic surgery, physical medicine and rehabilitation, pulmonary and critical care medicine, urology, the Kennedy Krieger Institute, and the Master of Education in the Health Professions programs. She also serves as the information specialist for the Cochrane Urology Group, a member of the Welch Library Assessment Committee, and a member of the Outcomes After Critical Illness and Surgery OASIS Group. Carrie enjoys her work as a medical librarian because it allows for lifelong learning and fosters relationships at every point of the healthcare delivery spectrum. Everyone, please welcome Carrie.
Thank you, Tony. Can everybody hear me?
Yes, I can hear you.
Okay, great. Good. Just wanted to confirm that. So thank you so much for joining us. I see there's 88 of you here. That's just wonderful. So I'm glad you could join us this morning. Today I'll be speaking about my experience doing reference and instruction on the topic of predatory publishing or evaluating journal quality and how librarians can lead the way. As Tony said, I'm a clinical informationist at the Welch Medical Library, and I'm a liaison for a number of departments, but my busiest departments are probably physical medicine and rehabilitation, pulmonary and critical care medicine, neurology, orthopedic surgery, and the clinical nurses. And I've been working at Welch since April 2012. As for the Welch Library, we are a team of 12 informationists covering clinical, basic sciences, public health, community and global health, and outreach. We liaise with the School of Medicine, the School of Nursing, the School of Public Health, the Hopkins Hospital System, Kennedy Krieger, which is a nearby partner institution, and the community. We work on an embedded model, which means that while we have a physical location on campus, we are not in the library. Our motto is wherever you are, and our practices reflect that. So we try to meet with our users at their point of need, and I'm sure many of you are familiar with this type of service. Today, as I mentioned, I'll be discussing issues in predatory publishing. I'll first tell you about mine and my colleagues' experience, the tools and resources that I use, issues and concerns with this topic, and then leave it open for discussion at the end, although as Tony mentioned, you're welcome to send in questions in the chat box throughout. I really hope to make this a discussion and a platform that we can share our tips, tricks, tools, and resources. So to speak to my experience in assisting patrons with the issues of evaluating journal quality, I have answered about one question a month on evaluating journal quality. This is typically a patron sending me an email saying that they're interested in publishing in a specific journal. They give me a little bit of background, and then they'll ask for my professional opinion. I'll generally go through the channels that I'll talk about later this morning to make an assessment of the journal and then I'll get back to them with my thoughts. These questions are coming mostly from my departments of physical medicine and rehabilitation, pulmonary and critical care nursing, and it usually takes, pulmonary and critical care medicine and nursing, and it usually takes me anywhere from about 15 minutes to an hour to make a reasonable evaluation. And when I get back to them, I'll give my opinion, but I'll also include a link to my digital handout, which is linked here and in the handout that I sent yesterday, or that Tony sent yesterday, and a link to our writing and publishing guide, which has a lot of these tools linked. And just a note, as I go on speaking today, you'll probably hear me use the term predatory publishing and evaluating journal quality interchangeably. I consider predatory publishing to be the buzzword phrase that people like to talk about, but really it boils down to evaluating journal quality, and so for that reason, I use them both. Recently, I've started incorporating at least a slide to each presentation that I do, and I do what I consider to be a lot of presentations. It's usually one a week or more, sometimes less. And a few weeks ago, I presented to my pulmonary and critical care faculty at their weekly lung research conference. This was a 1-hour lecture specifically on the topic of predatory publishing. I was invited by one of the fellows who was coordinating the conference. The attendees were mostly faculty and fellows, and they had a lot of good questions for me all throughout the presentation. It went really well, but it made me think about the ways that I might shape this kind of instruction going forward, since this was the first time I'd really devoted an entire hour to the topic. So I'll be talking about that a little bit more later. And the format of my lecture was basically this. I outlined the various publishing models. I talked about traditional, which is of course subscription-based, how you could go to the library, hold the journal in your hand, see its scope, and evaluate its quality tangibly right there on the spot. I talked about the rise of the open access movement and showed the first 3 minutes of this excellent video linked here about open access. It's from PhD Comics and coincidentally one of the founders of the Public Library of Science. I debated whether to show a video in my presentation, but this one was really well done. I thought it was worth it. Then I talked about hybrid journals, and I showed an infographic that outlined the costs associated with traditional versus hybrid versus open access publishing. And the infographic that I showed came from a Van Noorden article in Nature that was referenced in the handout sent yesterday and at the end of this presentation. Next, I mentioned trends, the internet, digitization, new fields of research, new researchers in the field, public access policies, and open data. And people always get a kick out of I call them scams, but the ones where a dog sits on an editorial board or a person publishes a research paper about Star Wars. And I saw one of you mention that in the comment section this morning. There's a paper about midichlorians, and it's really about Star Wars, but it made it into a peer-reviewed journal. So they get a kick out of those, so I mention a few. Next, I mention journal metrics, and I show how many there are: impact factor, site score, the SJR, the SNP. I think there's even more than that. And I talk about how it's not always an indicator of quality depending on the field. A larger field of research will have higher impact journals by default, but this doesn't mean that smaller fields of research are any less worthy. Then this is the challenging part. I presented them with tools and resources that they can use to help make their own publishing decisions. This is where I think I may need to pare it down and offer, I don't know, up to 2 to 5 good tools, but probably not more. More than that might be overwhelming. But I wanted them to know about all the great tools that exist for authors of manuscripts. And I divided my resources into 3 categories: subscription-based, publisher-based, and standalone sites. And we'll be talking about that later on. Finally, I mentioned the Sherpa sites, Sherpa Romeo, where they can find open access authors' rights, and the ICMJE, that's the International Committee for Medical Journal Editors, which talks about the ethics of being a journal owner and includes a recommendation for ethical conduct for both authors and journal owners. So I think it's important to know that those kinds of tools and resources exist. And then I always like to end with a few questions that I ask the audience. I hope it helps their learning and retention, so I asked them to name a few tools and a few trends that have caused a landscape where predatory publishing is possible. At least they wake up again. If you're interested in seeing my teaching materials, they're here. There's a link to my Google Slides on the left and a link to my digital handout on the right, so feel free to take a look and provide feedback if you're inclined. The digital handout can be bookmarked, saved, and shared. To prepare for this webinar, I also wanted to understand the experiences of my colleagues, so I put together a brief survey in Qualtrics with the following questions. Have you answered reference questions on this topic? Have you given a dedicated lecture on this topic? Have you worked this information into other presentations? What tools do you like? What tools don't you like? And do you have other thoughts about how librarians can lead the way? I think this would be a good time to use the chat box if you're willing. I'd like to hear from you all. How many of you here today have given a dedicated lecture on the topic of predatory publishing? And if so, what was your population? In the chat box, just put a Y for yes if you've given a dedicated lecture. And if you'd like, put the population. Was it medical students, nurses? Was it faculty? Was it residents? And if you haven't given a dedicated lecture, you can put an N for no. I'd just like to get a sense of how much librarians have been involved in this. Great, you guys are really great. So mostly no, but a couple of yeses, and we see faculty, nurses, nursing faculty, staff and residents, aspiring students. Thank you very much. Thanks. That's really nice. So as far as the Welch informationists are concerned, I found that most of us, 90%, have answered reference questions on the topic with a frequency of about once a month. 40% of us have given a dedicated lecture on the topic. And again, 90% of us mentioned it in our other presentations. I think it's a matter of promoting this information so that people know that it's out there. I received some interesting free text comments, and I'll read them here. There are many motivations for our users to publish, and it's important to be sensitive to them. That said, while we investigate options on a case-by-case basis, we understand that they will ultimately make the choice as to where to submit their work. This is me again. I think it speaks to the experience that many of us have had where, as good as our information is, and despite our best advice, our users will end up making their own decisions, and in fact they sometimes have gone ahead and submitted to a questionable journal despite our warning. I know in my own circumstances I'm acknowledged in 2 journals that I would consider questionable, but in one case I did warn the faculty member, and they said they didn't think it was a questionable journal and it was okay, they were going to go ahead. And in the other case, I didn't know about it. So we're not always in control. The next comment was, I think it would be useful for librarians to include information about this issue in our talks and lectures. It would also be helpful to know what other agencies and departments on campus are also dealing with predatory publishing. That being said, I think it does tend to be a really pervasive problem. It would be helpful if we could align our tools and resources so that we can tackle it a little better. Someone said, if I were giving a lecture, I would be sure to include examples of the kinds of emails I've received from likely predatory journals. I've heard it likened to the email scams of the early 2000s, the prince who has a lot of money to give you if you can only provide your bank account and routing number. But I can't definitively say that even the best journals won't solicit someone who's outstanding in their field. It's probably less likely, and I know that I certainly get a lot of really silly solicitations. But as for our faculty who are doing premier research, I can't say definitively that they won't be solicited even by a good journal. And the last one was, we need to get the word out to our patrons that resources exist for them to check on their own, should they wish, what they are and how to use them, and that we are here to help them. Ultimately, I think it's up to librarians to give them the tools they need to make the decisions on their own, given how rampant that predatory publishing seems to be. I think it's worth mentioning that institutionally, we just began an Office of Scholarly Communication with a Scholarly Communication Coordinator, and this grew out of our Scholarly Communication group. This is a kind of a tongue twister, Scholarly Communication. This person's job is to coordinate services, communication, teaching, and instructional materials across the Hopkins libraries. This position will address things like copyright, fair use, predatory publishing, and open access. So I really think that it's going to be filling a need that we need, and I'm excited to see what what goes forward with that. So now I'd like to move on to the tools that I have found to be useful in the endeavor of helping people make informed decisions about journal quality. I'll be speaking a little bit about each one, and this is where I really welcome you to put your commentary in the chat box. Do you like the tool? Are there problems with the tool? Is there another tool that you use instead? So this is where I think we could all benefit from sharing, so please chime in. And I see a comment that just came in. Many journals are now asking even for permission from those that are acknowledged in a paper. Yes, I think the more reputable journals do ask for permission even to be acknowledged. That's a good point. So as for the tools, being a librarian, naturally I categorize them into 3 buckets, but I'm sure there's other ways to categorize them, and in fact it's probably something worth thinking about. My original organization scheme was resources that are subscription-based, resources that come from publishers, standalone sites, which are basically everything else. I can't show or demo all of these today because of time, but at the end I will show a couple. And the links are on the very utilitarian handout that was sent out to you yesterday. All the links are there and the references from today's presentation. So if any of these are new to you, any of the resources that I'll talk about today, please give them a try. Subscription databases, and these are not alphabetical. I mean, these are not in order of importance. These are alphabetical. And so it'll depend on which of these resources your library subscribes to. Maybe you have one of them, maybe you have all of them. So we're going to talk about these and how they can help you and patrons make informed decisions. The first one is Cabell's. It bills itself as a scholarly analytics tool. It has 11,000 academic journals, curated by data specialists, and each entry shows contact info, manuscript submission guidelines, metrics, and they have a whitelist and a blacklist. Now, our institution, we only subscribe to the whitelist, although I have seen the blacklist before. There's one main problem with Cabell's. Does anybody know what that is? And if so, will you put it in the chat box? The main problem with Cabell's is that they don't really cover medicine. They don't cover medicine well at all. So they started out as a business database. They have coverage in psychiatry, biological sciences, nursing, and health administration, but they don't have medicine, so only peripherally. I think they're working on that, though. I did listen to one of their webinars, and it seems like they're ever growing. But it's pretty useful when you do find something there that you know, if you're working in nursing or psychiatry, it might be a useful tool because it has some very nice metrics. But I'll move on to the next one. Someone commented that my microphone isn't working properly. Can Tony confirm that you can hear me?
I can hear you clearly, so okay. I'm not sure about the person's not being able to hear. And I can see comments from others in the chat saying that they can hear you clearly. Okay, good. I would be sad if that was the case. So I'm glad. I'm sorry that the other person can't hear me. I'll keep going. Journal citation reports. That's now called Insights Journal Citation Reports. It's from Clarivate Analytics, hosted by the Web of Science, and it gives the basic bibliographic information of a publisher and its ISSN, its serial number, and it gives the impact factor. And a lot of our faculty, and I'm sure a lot of your faculty too, are very interested in impact factors and use this as their sole metric for evaluating journal quality. But I think it speaks only to the fact that a journal has been around for a few years and it's been cited. I don't think it's a perfect metric by any means, but it's a useful one. So you can get to that through the Web of Science, and you can look up different journals and see their impact factors. Now for me, it's been limited. I can't always find journals that I would expect to be there. So I just check my connections to make sure that my microphone is plugged in. It's all good. The next one is Ulrich's Web. It's a serials directory, and what I like about Ulrich's Web is it's really broad, really comprehensive. It's got over 300,000 serials in 900 subject areas. It includes reviews written by librarians, and what I like is it allows you to be your own private detective. It has a wealth of information that can allow you to go on and do further investigating, including the publisher's address, the contact info, the ISSN, and more.
So in my survey, one of the librarians said that they would go to Ulrich's Web, find the address of a publisher, and then verify it in Google Maps, which honestly isn't something that I had thought about before, but I think that that's an interesting way to go about it. And then the last one is the Web of Science. Now, someone correct me if I'm wrong. I wasn't able to verify this completely, but I'm pretty sure that the journals that are in Web of Science are the journals from Journal Citation Reports, so they have an impact factor. So there's 8,500 journals in Web of Science, and I understand that they go through a rigorous selection process to be included. So it's worth checking if someone's interested in publishing to see if it's indexed in the Web of Science. And that concludes the subscription databases, so let's move on. Yeah, someone had a good point. Some publishers are based out of apartment buildings and neighborhoods and end up being an empty lot. So maybe even if your maps verifies the address, it's worth doing sort of a checks and balances and checking on a couple different ideas so that you have a better idea of whether it's a reputable publisher or not. Someone asked, what about Medline? Yes, I will talk about Medline. It's a free resource, right? PubMed.gov. So I'll be talking about that in a little bit. So the next slide are journal finders and suggesters. And this isn't so much to evaluate journal quality as it is to find a journal that matches someone's research and is reputable. So these tools all use natural language processing to match keywords to journal fields of interest. And the three that I'm aware of, whoops, I went too far. The three that I'm aware of are the Elsevier Journal Finder, the Springer Journal Suggester, and the Wiley Journal Finder. So the Springer Journal Suggester, they have a results list that includes impact factor, open access options, first decision average days, and percentage acceptance rate. Those are all useful metrics for someone who wants to publish. And then the Wiley Journal Finder has 3 search options. You can browse alphabetically, by subject, or search by keyword. So I won't spend too much time on those, but I do think they're useful for our faculty and our authors to know about.
Hey, Carrie?
Yes.
Thomas wants to know, and he says, Thomas says, perhaps I missed this in the beginning, but for this presentation, are predatory journals that are open access charging a fee for publishing? So they wouldn't mean that those are subscription-based. He just wants some clarification, I believe.
Well, I guess predatory publishing does typically apply to open access, and I think it varies as far as whether they're charging a fee to the author in the form of an article processing charge or publishing or asking, well, they're not asking a subscription fee because they're open access. So I think, yeah, we're mostly talking about open access here. Does that help?
I think so, yes.
Okay.
And then I'm not sure, I might have missed an earlier part to Lisa Glandon's question where she asked, what about medicine? And it may be related to the previous slide on one of the resources that you had mentioned.
Right, so Cabell's coverage in medicine is really sparse. So it might have been in reference to that.
Okay, I think so, but Lisa, if you would like to clarify further, that would be great.
Thanks, everybody. I see so much good chat going on. Okay, great. Thank you, Lisa. So I'll move on to the standalone sites, which is really miscellaneous. And again, these are listed in alphabetical order with no particular order of importance. And so first one is Beale's List. Have you heard of it? I'm just kidding. Of course you've heard of it. It's created by Jeffrey Beale, librarian at the University of Colorado. He's responsible for the term predatory publishing, but he took the list down in response to threats on his job. However, it's archived and maintained anonymously. I have found it to be useful, and I continue to find it useful, although I'm aware of the debate surrounding it, which is to say that sometimes publishers are listed with no reason given, and that people believe a list of this magnitude is Herculean to maintain accurately. So I understand those ideas. However, I've still found I still found it very useful as a starting point when I'm starting to evaluate a journal. So it is now posted on a different link than it used to be, and that link is in the handout. Then there's the Committee on Publication Ethics. This is a nonprofit whose mission is to define best practices in the ethics of scholarly publishing and to assist editors and publishers in the process. Membership is assessed on a set of criteria, including 16 principles of transparency, and if any of these principles are violated, then members are removed. You can go in and search the members list, which is available both by publisher and by journal. And if you go into their website and you look at those 16 principles of transparency, you get a really good idea of what their standards are. So I think this is a useful resource for librarians as well. And not too unsimilar is the Directory of Open Access Journals, the DOAJ. This is a website that lists open access journals. It's community curated, and it's maintained by a group called the Infrastructure Services for Open Access team. And you can search the list by journals and by subject. That's probably a go-to for anybody who's doing any sort of open access publishing. The next tool I like is called Flourish OA, Flourish Open Access. I think it's a play on Publish or Perish, if any of you have heard of that software, because on their site it says Publish and Flourish. It's made by software developers, and it's a really fun visualization tool. It compares article processing charges against an article influence metric. They use the eigenfactor, which is Jevin West's article influence metric. And so they have this scatter plot where you can click on a journal and you can see journals that have more influence with a lower cost or less influence with a higher cost. And it's kind of a fun and interactive metric visualization. It is a little bit limited. They're kind of new, so there's not a lot of journals there, but it's a fun tool to play with if you get a chance. They use data scraped directly from the publisher's websites. And another feature that they have that I like is an article processing charge graph by journal category and research field. So for each major research field, it shows you what the average article processing charge would be. That gives you a good idea of what to expect. Then we have the, let's see, Journal Guide, and that's a tool from that I found on McGugan Library's LibGuide author toolkit, so I thought that was pretty nice. It's a database of 46,000 journals spanning fields and disciplines, maintained by an independent company. So from what I understand, they made this tool to use in-house, and they saw that it was really good, and so they decided to make it public. They use a metric called the SNP, Source Normalized Impact per Paper, as a journal's measure of impact. And I think their benefit, and they say this as well, their benefit is finding niche publications and making consistent comparisons across journals and across disciplines. That can be difficult to do independently. And in Journal Guide, you can search by journal name, publisher, category, or you can even do natural language processing, which is where you enter your title or your abstract or some keywords. The second to last one on this page is Journal Author Name Estimator. The acronym is JANE. And it's like a lot of the journal finders and suggesters from publishers that I mentioned earlier, but it's not tied to any one publisher. In fact, they use data from PubMed. But they have a warning on their website now. It says, beware of predatory publishing. And so now they've changed their practices to reflect this warning that they will notify you when a journal is indexed in Medline, which is a higher quality indicator than just simply being in PubMed. So they do warn you to make your own assessment. But that is a nice natural language processing tool that people can use to match their research to a journal. And the last one on this page is Nurse, Author, and Editor. It's a directory of nursing journals. It's vetted by committee, and nurses can navigate the directory to look for appropriate journals. Now the interface is a little old looking, but I still think it warrants mention because it's got a lot of good journals listed, and especially if you're working with nursing populations which tend to be overlooked in the publishing world, it can be a good tool. So that's the first set of standalone sites. Anybody have any thoughts or comments on those? Have you used Beal's list? Yes. Yeah. could you say more about the difference of Medline and PubMed in regard to journals? Yes, I'll be talking about that on the next slide. Somebody said yes to Beals, Cope, DOAJ, and Jane, but not the rest. Okay, well now you have some new tools in your pocket you can try out. So I hope that's useful. Let's go on to the next slide. And I promise this is the last slide of standalone sites, but they're all good for different reasons. And so that's why I put them here. So the next one is the Open Access Scholarly Publishers Association. And that's a nonprofit company representing the interests of open access journal publishers. They also have a members list. So that's why I mentioned it. You can go and you can look on their members list for publishers. And they advocate for open access with integrity and standards. I think it's a little limited, though, because you have to apply to be a member. The publishers have to apply, and so it's limited in its scope. And then the next one, of course, is PubMed. That's, free from the National Library of Medicine. But we've seen recently that predatory journals can make their way into PubMed simply by existing in PubMed Central, which is the open access component of PubMed. So you can look to see if a journal is indexed in PubMed, but it would be better to look and see if it's indexed in Medline. And so when you go to the PubMed homepage, under More Resources, there's a link that says Journals and NCBI Databases, and that's where you can look for your journal of interest. And under that journal of interest, you'll see a little bit of metadata, and in that will be included the terminology indexed for Medline, or not currently indexed for Medline. So if it's indexed for Medline, it's gone through a selection process and been vetted, a little bit more than the journals that are making their way into PubMed Central, which is the open access portal. So let me see some of the comments that are coming in. Somebody said, do you suggest looking at IJCME, the International Committee for Medical Journal Editors? Yes, I do. And WAME, I'm not familiar with WAME, so if you want to tell us more about it in the chat box, that would be great. And I'll move on to ROAD. ROAD ISSN is a registry of open access ISSNs. So a common practice of predatory publishers would be to give a false ISSN. And so you wouldn't know that it's false unless you have somewhere to look it up. Well, you can do that with ROAD. It's called the ROAD Project. And so you go to the website and you look for the ISSN and you can verify that it's true and correct. That's kind of a neat idea. And then there's one called ROARMAP. ROARMAP is a registry of open access mandates and policies adopted by universities, institutions, and funders. You can browse by policymaker, funder, and organization. It's more helpful in that it provides clarification for authors on whether they are tied to any open access policy through their institution, and so it thereby might change the journal selection process and decision making. And then we'll talk about SEASide. SEASide uses Scopus data. It's using Scopus data, but it's maintained by SEASide Lab, which is a tech company in Spain. They use their own metric called the SJR, the SEASide Journal Rank, which is based on other metrics. And you can search by journal ranks, country ranks, and biz tools. They have a lot of useful information about the journal, including open access options, country of origin, and other metrics. I personally have used SEASide when someone comes to me and says, I'm trying to find a journal. I've been rejected a couple of times and I can't think of anything else. So we'll go to SEASide and we'll take a look and see if we can find something that might fill in their category and be relevant that they maybe hadn't thought of before. I see some questions coming in. I'll address them in just a moment at the end of the slide. The next sites that I mentioned to my faculty and staff are Sherpa, the Sherpa sites. So the Sherpa Romeo in particular, because it helps authors make sense of copyright and archiving policies if they're doing open access publishing. They might want to know if they can post their PDFs or what their rights are as an author. So Sherpa Romeo has all of those policies aggregated into one place. I think that's really useful. The next one is SPARC. I think it warrants mentioning. It's a global coalition aiming to make research open. They advocate for open access, open data, open education, and they have a few useful resources, including article and data sharing requirements by federal agency. So it's less for evaluating journal quality, but more for knowing what's required of you as an author. And last but not least, there's Think, Check, Submit. It's only last alphabetically, probably first on my list. I think it's one of the most empowering tools. And it's got a checklist of questions you should be able to answer yes to before you submit to a journal. And I'm not going to read you the checklist. We'll be looking at it a little bit later when I share my screen. So I see these. Let's look at these comments that are coming in. So someone asked, articles in PubMed Central are because of NIH funding. Doesn't that imply that they've had some level of vetting? And someone answered, not necessarily. PMC criteria is open to any English language life sciences journal that meets NLM standards for the archive. A journal must qualify on 2 levels, both the scientific quality of the publication and the technical quality of the digital files. And I remember seeing an article come out, I think it was late last year, how we're seeing some predatory publishers show up in PubMed Central. I think that's the case. And someone just posted a link to the PMC criteria. Thank you. You guys are really on the ball today. Great. So moving on. I know there's more tools and resources. Somebody mentioned WAME. There's so many more, but it can often feel like you're falling down a black hole or entering the abyss. There's just so many. It's hard to figure out when to use them and when not to. And I think it's important to mention, I didn't have a slide on this, but in any interaction with our patrons, we want to make sure to point out some signs of predatory publishers. So I'm going to try this tool here in the WebEx software. See if I can type something. So you won't see it right away. Okay, I'm going to click away from the, I just typed some words there on the slide. So these are some criteria you can use to remember what are characteristics of a predatory publisher. The peer review process is unclear. There are hidden fees that you don't know about until after you've submitted and been accepted. They solicit you with silly emails. They have fake editorial boards. They have false ISSNs or impact factors that are not correct or not true, and they're not indexed in any major database like PubMed, Web of Science, Scopus, or some of the bigger ones. So keep those in mind when you're talking with your patrons. The more education we can do, the better. And so now, instead of jumping ahead, I'd like to look at a few of these tools. And I'm going to share my screen. So here's Cabell's. I'm not sure if any of you have Cabell's available through your institution. And like I said, they don't have a lot of coverage in medicine, but they do have 18 major subheadings in health administration.
Hey, Carrie?
Yes?
I do not see your screen right now.
Oh, you don't? It
I
says
do not.
you're sharing. Let me go back and try it again. Share my desktop. Do you see it?
I do not.
Okay. I will stop sharing.
Oh, someone else says that they see it. I'm sorry. So how about we go back and do that then?
Okay. Hopefully following all the instructions from earlier. So I'll just be brief. In Cabell's, you can go to Advanced Search. And they have some really nice features here for searching. You can search by open access, you can search by peer review type, and APC and acceptance rate. But if you go into disciplines and topics, you can search by their subheadings. Oh, let's go all the way down into nursing, because I think that would probably be the most useful for medical librarians. So geology. Nursing. So if I select nursing as my criteria, it says nursing is selected. You see that here. And then you click search. And you can click on any of the journals that you're interested in, and I like the way it gives you the information. So it has some descriptions, it has some little icons that help you understand the journal a little bit better. And depending on how much information they have, you can also see metrics and contact information. So that can be useful, I think. I'll go back to Cabell, Ulrich's Web. So in Ulrich's Web, you can do a keyword search or search by ISSN. So I will just type intensive care. And you get a bunch of journals. Now on the left, you can limit to refereed or peer-reviewed. So that goes from 2,800 plus to 697. And at that point, you can look at any of the journals you're interested in. And if you scroll down, here's the detective stuff you can do. You can go to the publisher and get their address and take a look and make sure that it's valid. They also have the ISSN and some other things that might be of interest to you. Just showing each of these a little quickly. There's Journal Guide. It's a new to me tool. It might be new to some of you too. I just learned about it a couple months ago through Twitter actually. And here you can do natural language processing, so you can enter your title and your keywords. You can search by journal name, by publisher, or by category. So let me just enter some keywords here. So I entered intensive care rehabilitation, and I get 16 journals that match my search. You can see you can limit to open access if you'd like. You can include journals without a SNP impact metric. But if you scroll down, you can click on a couple. Well, those aren't really relevant, but you can click on a couple. Let's just show you. And then once you click on a couple, you can compare. And so when you compare, you'll get the journal impact and affiliated societies and where they're indexed. I think that's very useful for librarians to know, because you can look independently, but you can also see it here. And then last but not least, I wanted to show Think, Check, Submit. If I were going to give one tool to a library patron to help them, I would give them this tool. It's just really great. It's really empowering. It's going to help the person make their own decision. So if you go to the check part of Think, Check, Submit, let's scroll down, go to the check part. These are the questions you should be able to answer yes to before you submit a manuscript. So, do you or your colleagues know the journal? Have you heard of it? Can you easily identify and contact the publisher? Do you understand the peer review process that it's using? And it's a list, about 20 or so questions. So that's just such a great tool, and I've been sharing it a lot. They're very responsive. If you write to them, they'll write right back. And they also have languages translations, so if you're doing any sort of global health, you're working anywhere else in the world, you might consider using Think, Check, Submit in any other language. So let me stop sharing now. Sorry that didn't work for everybody. So let's move on. I found that a really great way to discover some of these news tools is to keep an eye on not only Twitter and social media, but on other libraries' research guides. So I'd like to highlight a few that I found here and that I like for different reasons. There are links to them here and also in your handout, and I have screenshots in the following slides. So we have, of course, the Welch Library Writing and Publishing Guide, which is the one I give to our patrons when they have questions, and the Eisenhower Library Guide, which is the initiative of the Scholarly Communication Committee, and then a few more, McGugin, UCLA, University of Pittsburgh, and Rutgers. So let's take a look. Here's the Writing and Publishing Guide from Welch, and you see our tools are listed here. We talk about journal metrics. There's a widget for searching the DOAJ, and the Think, Check, Submit video. This is the open access guide at the Eisenhower Library, which is our undergraduate library on the campus of Hopkins. And like I said, this is the initiative of a scholarly communication coordinator. I think it's organized really well, and they have a lot of really great resources. So I am looking right now at the Predatory Journals and Conferences section, but the Open Access and the other sections all have really nice tools and resources linked there too. So it's worth taking a look at. And the McGugan Library Guide I found on Twitter, someone tweeted it, and I found the journal guide that I talked about earlier, and I think it's organized really well and has a lot of useful tools for authors to use. This is the UCLA Libraries Guide, and the reason that I like this one is it's very empowering. You could send this to any person, and they have to be able to take these questions and do a critical assessment of the journal or the publisher, so they can use this guide and answer these questions themselves. I think one more. This one is from University of Pittsburgh, and I really like their infographic, which is a little bit cut off here, but they talk about predatory, phony, versus legit publishing, and they have some infographic information here that might make it easier for someone to understand. And the last one is from Rutgers, and I'll give credit both to Rutgers and the University of Manitoba Libraries because do you see that little video there under what are predatory publishers? That's a video from the University of Manitoba Libraries. And I think that it's a really good video, really cute and engaging. And the whole guide is organized really well. I think it would be a useful tool for someone to have in their pocket. So something that I do on occasion, if I'm interested in a specific topic, I'll go to, if any of you are LibGuide users and you use SpringShare, you can go to the community site, you can enter a few keywords, and you can find LibGuides on that topic. So I think it's a great way to see what other people are doing and to find new tools that maybe you hadn't thought of before. So let's talk about issues and concerns we face as librarians when we provide reference or instruction on predatory publishing. And you all have had some really great comments today. Earlier I mentioned going down the rabbit hole or going into the abyss with the tools. And in fact, I think as a librarian, it's important to decide where to stop. There's so much overlap between open access as a fine and reputable establishment, predatory publishing as it exists, and evaluating journal quality or finding reputable journals for your research. So I really have to think about my audience and decide which of these circles would be the most important to them, how to frame my reference interaction, and what tools they really need in order to make better decisions. And I know that in the librarian world there's been a lot of talk about using the phrase predatory publishing, that it's too incendiary and too condemning. Well, there's other ways to say it if you aren't comfortable using predatory publishing. My favorite one is probably questionable or suspicious. I didn't put suspicious here, but that's another good one. And then to the pulmonary and critical care faculty that I presented to, like I said, they had a lot of really good questions. So some caught me off guard and some were easy to answer, so I wanted to talk about them here. Somebody asked if they had accidentally published in a predatory journal that goes defunct, where will the research live? Well, it'll depend on where it's been archived, and I don't think there'd be any problems with them resubmitting their work if the journal is defunct. Someone asked if these open access nonprofits are self-report, the ones like COPE and DOAJ, and if so, doesn't that lend itself to bias? Well, in these cases, a publisher has to apply to be a member, and they have to meet a minimum set of criteria, and if they fail to meet any of those criteria, they're removed from the list. So, no, I don't think it lends itself to bias, and I think they're all doing good work and trying to set standards in the field. I think it's really hard to answer the question of how many people are falling prey to predatory publishing scams. It exists on a spectrum from very bad with malicious intent to maybe just a brand new journal, so I'm not aware of any existing statistic on this. Someone asked, aren't big publishers letting predatory journals through by accident? And I guess it's potentially possible as it's becoming easier to impersonate a real journal. And of course, no, open access does not mean predatory, and I think that's something that, it's the curse of knowledge. We assume that our audience knows what we know, but it's very important to say that no, open access does not just by default mean predatory. And I see we're getting a little short on time, so I just wanted to skip ahead. I won't talk about all of these, but you can think about them and see if you get any questions like this too. But one of the ones I thought was worth addressing is, can I use this article that's in a predatory journal to cite in our manuscript? And in that case, I say, well, here's my critical appraisal toolkit. Why don't you try critical appraisal on the research and see if it's good quality research? And at that point, we might look at CASP, one of my favorite tools, Critical Appraisal Skills Program, or Joanna Briggs Institute Critical Appraisal Tools. Now, these aren't just for nurses, even though it's Joanna Briggs. They have a great toolkit for assessing studies and systematic reviews and other kinds of research. So just some other thoughts from our librarians. It's a holistic process. We need to provide the best information that we can. We need to teach them how to make these decisions on their own. And so now I do see I'd like to leave a little bit of time for discussion. And I saw some comments come in here, so let's look at the comments. A real problem for me are very new journals, Journal of Medical Internet Research. It has sister journals that are not yet indexed in major databases and have no impact factor, so they all have attributes of a predatory journal, but they're just too new. Yeah, I think that's true. Like I said, I won't always see a new journal in journal citation reports, but it doesn't mean that that's a bad thing. Sometimes they're just too new. And so that's why I always urge people to use their intuition and a list of criteria to make this decision based on several factors and not just one factor. Let's see, any other comments? Someone says, I tell clients that good articles can end up in bad journals and bad articles can end up in good journals. So it's important to evaluate both the article and the journal level. Yes, that's so true. Thank you, Lisa. Are there any other tools that you use that I haven't mentioned today? I'd love to hear about them. My library has recently published a LibGuide about predatory publishing. Thank you. We'll take a look at that. What about backlash for saying that a journal is predatory? I think this has happened to Jeffrey Beal. Yes, actually there was one site I wanted to show today. It was just a ridiculously hilarious site, but I decided not to show it. And what it was a publisher's website, and it looked really good at the top of the website. But if you scroll down, they just had a lot of the lorem ipsum text filler. But it wasn't lorem ipsum. It was about beer. It was so weird. But at the top, it looked like a perfectly reputable publisher. But yeah, you really can't. You have to be careful about that, how you say it and who you say is predatory. Someone says ROAD. Yeah, ROAD, ISSN, the ISSN serial directory. Some publishers publish journals that are reputable, indexed in Medline, but publish others that fall within the predatory continuum. What do you tell users then? I think they need to evaluate it on a multitude of factors and not just one. And I think intuition can come into play here. Somebody says they do private investigator type work using business databases and resources to look up company names. Oh, that's great. I hadn't even thought of that. That's great. Thank you. Did you mention this one for impact factor, SciJournal.org? No, but I think that's an initiative of the Simago people. I might be wrong, but I'll look at it. SciJournal.org. Thank you. And of course, this is being recorded, so anybody who wants to come back and take a look at these links later can do so. Okay, we have a few more slides here. Predatory publishers want confusion. Yes, they do. They want you to be confused so that you give them your money. I do think it comes down to money. If there's money to be made, somebody's going to try to make it, and they can do so very cleverly. So I want to thank Elizabeth Dyer and Michelle Bass. They both shared their slides with me when I was preparing for not only my pulmonary and critical care talk, but also this talk. And Elizabeth Dyer's slides are linked here, and she has this fun exercise that she does with her patrons where they actually go through the steps of evaluating a journal. So I think it might be worth looking at that slide presentation. And I wanted to thank my informationist colleagues at Welch Medical Library for participating in my survey. And then here's a reference list that is also included on your handout. And I'm going to thank you, encourage you to contact me by email, follow me on Twitter at CarriePrice78. Thanks for joining me, and I'll turn it back over to Tony.
Thank you, Carrie, for your informative presentation. I learned a lot of great new tools, too. We still have a few more minutes, so if anyone has any last-minute questions that you would like to ask Carrie, please feel free to utilize the chat box. I will go ahead and also put into the chat box Carrie's email address. So if you want to, you are welcome to email her after the webinar with any potential questions you may have. And in the meantime, I will say, as a reminder, this webinar has been recorded and will be posted on the NNLM YouTube channel as soon as possible. If you would like, please feel free to subscribe to our channel. And let me go ahead and paste that into the chat box as well. Once the webinar is available, I will email you a link to the webinar, as well as our presenter slides for this presentation, and I'll also include the handout in case you did not receive that handout earlier. I would like to invite you to our upcoming webinar, Partnering to Transform the Care Environment for Transgender and Gender-Expansive Patients, on Thursday, April 5th at 2 p.m. Eastern, 11 a.m. Pacific. This will be presented by Dr. Scott Nass, who is the Director of Inpatient Education and Family Medicine Residency Program at the Citrus Valley Partners and David Geffen School of Medicine at UCLA. And I'll go ahead and share that with you as well. And then lastly, I want to thank everyone for joining today's webinar. Please take a moment to evaluate today's presentation. At the end of the evaluation, you should see information on claiming MLA CE credit for today's webinar. And I went ahead and pasted the link into the chat box as well for you so that you can click on it and it should direct you to the webinar. Thank you again for attending today's webinar, and Carrie, thank you so much for sharing your insights today as well. I think I saw a question, possibly, asking if there was a script that could be read. Unfortunately, I don't believe there is a script, but I will double check with our presenter later to see if there is something like that we could possibly share. If not, this is closed captioned, and the closed captioning I would be more than happy to send to you later on. And I'm trying to see if there are any additional questions. Well, I don't see any upcoming questions just yet, but Carrie, do you mind hanging on for maybe a couple more minutes? And
Sure.
then if there are, we will thank everyone for attending today. But everyone, have a great day and a great weekend as well.
Thanks, everybody.